Welcome back to our panelists. The State Department of Health is giving out a life-saving tool to drug users, fentanyl test strips. A recent piece from the Albuquerque Journal details the tactic, which Governor Michelle Lujan Grisham approved in February. New Mexico has one of the highest overdose rates in the country. And Algernon, do you expect these testing strips will have a significant impact lowering, I realize the word significant is problematic here, but would it have an impact lowering overdose rates if used properly, from what you've seen so far?
It seems so. I mean, it's important to humanize the people who are struggling with substance abuse addiction, and these are people who have decision-making faculties and are concerned for their health and welfare. And so the fentanyl strips really do it's interesting. One of the anecdotes about fentanyl strips was that people at first thought they were defective because they were turning up positive results almost all the time when people tested their heroin supply. And they later confirmed, no, it's because so much of the heroin supply is tainted with fentanyl.
Right.
And I think that that's eye-opening. It's not a panacea, and it doesn't liberate people from the shackles of substance abuse and addiction, opioid addiction, and all the rest of it. But I think it is useful information that will certainly have an impact. It's also interesting. It wasn't long ago that fentanyl strips were classified as drug paraphernalia.
Oh, wow.
And I think that shift kind of speaks to the larger shift of viewing this not as a moral problem, but as a public health problem. And really even just spiritually an assault on human freedom.
Yep.
And so I think that, little by little, as we reframe these tools as being not things that give permission for an immoral activity, but actually tools that can help if we are using our intervention strategically and with tremendous resolve and direction, can actually help to liberate people from the dependency and the prison of substance abuse addiction.
Yep. Well said. Just a reminder to the viewers, we're talking 70% of U.S. drug overdoses are from fentanyl. 70%. Now, Senator, let me ask you this. Test strips along with Narcan, of course, that's out in the news. A lot of folks know what it is, are both effective in saving lives. That's why the governor signed the bill making test strips legal. But now that these tools are there, how can we start to reach people before they're on the brink of overdose? Isn't that the next step?
Well, that's always been the real key, and that's the hard part, prevention. Yeah. It boils down to prevention, and what does that mean? I mean, it means school-based health clinics. It means activities that kids can say yes to, like the Girl Scouts and other activities. It means peer counseling. It means a robust behavioral health system, which we don't have. And so any of these tools that are pioneered, and we have a great record with the Department of Health. They do have the resolve. Right. They do have the history dating back to needle exchange in 1997, introduced here to try to meet people where they're at, not where they should be, but where they're at. And the prevention part is the hardest part, because that's the one that always does not get the funds in comparison to the crisis part.
Yep. Good point there. Rebecca, just a point that Senator made about the Department of Health, their report, New Mexico Department of Health, they're reporting over at least 1,200 people, and probably a lot more than that, have died from fentanyl overdoses in the state since 2019. But at the same time, officials say more than 12,000 people have been saved from a drug overdose by Narcan. That's hard to ignore, that number, 12,000. Should there be an argument anymore about these fentanyl strips and other things that we're doing to abate this? I mean, is the point proven?
I think the point is very well proven. And I think, I don't understand what argument is there against making these resources available outside of should we be using, government funding for this or not? And and thankfully, where we are in New Mexico right now is we're not having to look for pennies in between the couch cushions for anything. So like the resources are available. Let's get them out there and keep saving lives. To elaborate on what the senator said about prevention and getting in our schools and starting to talk about that, like my children are in elementary and middle school, and we have a lot of other moms whose kids are in middle and high school who are having to have conversations with their kids about things that were seemingly harmless, like cannabis being used by kids in middle and high school that are now cannabis is being laced with fentanyl.
Wow.
And kids thinking like, oh, well, it's just weed. It's not anymore.
Right.
And so we have to, if this is happening in middle school, then that means in elementary school, we have to be making resources available and finding the best way to educate our children about the dangers of this, going down this rabbit hole. It's not easy to get back out. And so I think anything that we can put into educating our students is going to be major in the long-term solution.
Algernon, I ask you to pick up on what Rebecca just took us to. I appreciate this because we've seen reports across the country in the last week of new pills made to look like candy that contain fentanyl. And DEA Administrator Ann Milgram is calling for groups behind these drugs to drive it. They're trying to drive addiction in young people. Do we need to do a better job about educating children about these dangers, particularly in school, as Rebecca was just mentioning?
Oh, yes. And really, when I was a kid during the Reagan era war on drugs, when it was really framed, the drug education for us kids was really framed around a moral binary choice. And I am now raising my own children in a community where I have reports of children of school age being actively pursued by traffickers who are trying to instill addiction in people, basically to guarantee themselves a market. Sort of like an even darker parallel to how cigarettes were marketed and became such an institution in American life. This is now happening on the streets of the community where I live. And so the education really needs to be different, and it really needs to be framed as hazard, harm, that the people trying to offer you an experience with these things are not offering you friendship, they're offering you bondage to a substance and perhaps an attack on your health and life.
That's right. Yep. Senator, let's finish here. Policymakers, where are they here in New Mexico? Meaning, perhaps a task force, perhaps a something to kind of get this more to the surface here in New Mexico. Because as I read it here again from the Department of Health, they've given out 15,000 test strips since the changes took effect in mid-May, and they've already ordered another 50,000. This is going to be a part of our life here. So is there an educational campaign that has to come from our legislature partly here?
Well, the legislature has done a job. It passed the bill.
True.
The executive is now getting her department to form regulations. But yes, I think we need a big education campaign, and the Department of Health has learned a lot about that because they have run anti-tobacco programs specifically geared toward youth.
Yep.
And they've done that. They use the tobacco funds that came to the state as a result of the tobacco settlement back in the late 90s, and ran all kinds of prevention programs using peer counseling, using school-based clinics, using very culturally appropriate stuff. That could be a model for a lot of the stuff geared toward young people.
Good points there, and I appreciate you bringing up the needle exchange. That was pretty forward thinking back when that we did here. That was really ahead of the curve, so we can get ahead of that curve again, certainly. Yeah. We'll have to wrap that up there, but thank you all for your thoughts. We'll be back here at the virtual roundtable one final time in less than 15 minutes to talk about the devastating impacts now extinguished wildfires are still having. But first, another environmental concern that has the potential to lead to more fire late in 2022. Scientists are warning of an extreme and prolonged heat wave starting this week that could fuel dangerous fire conditions into September. Our senior producer Laura Paskus checked in with the University of New Mexico biology professor Blair Wolf to talk about this research on how heat waves affect birds and other wildlife.